Today, you see fractures, veneers that come off, restorations that break, implants that lose bone and may lose complete osseointegration, pains that return even when everything seemed right in the diagnosis and dental treatment. You adjust, redo, change the material, alter the treatment plan, but the problem persists. And the truth is that the cause may be acting every night in the silence of your patient's sleep, and neither you nor the patient even notice it. This cause has a name, Bruxism. And what makes it even more challenging is that many times you don't even know you should be looking for it. This is the blind spot. The blind spot is what you don't know that you don't know. And today, the biggest blind spot in modern dentistry is not including Bruxism in the clinical equation. Bruxism is not just tooth wear. Bruxism is a silent amplifier of clinical failures. It accelerates fractures, compromises rehabilitations, causes rework and emotional strain, both for the patient and the dentist. And this is regardless of your specialty, your experience, or how many years you've been practicing, whether you're a general practitioner, orthodontist, implantologist, prosthodontist, or work in aesthetics or orofacial pain. Bruxism is affecting your cases. And if you don't diagnose it with a discerning eye, you'll pay the price with rework, wasted time, and loss of credibility. And you might be thinking right now, my patient isn't even paying for what I already do, let alone pay for a Bruxism treatment. This is a very real concern. You look at the patient and think they barely agreed to do a filling or a ceramic crown. How are they going to pay for a Bruxism treatment? Then you freeze, avoid bringing it up, and enter a clinical limbo, just like I mentioned at the beginning of the lesson. Or you even try, but you already speak assuming they're going to refuse. And this isn't just a pricing challenge. This is a challenge of communication, perception, and positioning, your positioning. Shall we think about this together? If the patient isn't paying, maybe the problem isn't the price. Maybe they didn't understand the real importance of the treatment you recommended. Maybe you weren't able to communicate that value. And why doesn't the modern patient make decisions based only on price? Why is it that today's patient doesn't decide based only on price? They decide based on what they understand, feel, and believe. That's where the blind spot comes in. You talk about the tooth, but they're waiting for someone to talk about a solution. You talk about the mouth guard, but sometimes they already have one, or they think, is this going to solve my pain? You talk about adjustment, but they want to know, will I stop breaking my teeth if I adjust my bite? So here, I'm going to share a truth with you with a lot of care. If the patient isn't paying, it's not because it's expensive, it's because it's still poorly communicated and often poorly positioned. If you want to know more about this topic, like and share this video with more dentists.